Southwest makes a difference in the community and have been doing so for about 40 years, providing resource, therapeutic services, groups, and activities for the youth. I myself have worked here for 20-some years, so there's generations of youth that have come through this organization, learning the skills they've learned, getting the support that they get. Their lives would have turned out a whole lot more negatively if Southwest wasn't here.
We all just really have a passion for kids, and we understand as systems therapists that a kid is a product of their overall environment and their families. So we always seek to engage and support families with multi-stressors that come up, like housing, barriers to food, and access to other resources. We're all really passionate about serving and being of service.
They're probably some of the most resilient people, but I always like to use the term unfortunately resilient. They have gone through things that they didn't have to, but because of the systems that are in place, they do. The communities that we work in, I mean, they're going through so many different traumas and experiences, but also lots of, system like oppression, and us just being able to be there for especially youth and just show up for them and help them talk about things that in their cultures they don't even get to talk about, right? And like validating and just supporting them, it goes a long way.
I just love where I work. I think it's a great place. I think we foster values that are real and authentic, and I think a lot of community mental health lacks that, and I think that we are very strong in holding our values.
The things that this community already struggles with, that Southwest is put into place to help avoid, all that just skyrockets without having a counseling department, but also without having family resource center, the ed center, right? Like all these pieces that Southwest gives.
These clients just would be struggling mentally and wouldn't get the help that they need, wouldn't get the emotional support that they need. Taking that away from them, I worry, would keep the youth isolated or feeling lonely or even feeling like another person has left their life if they're already feeling that way.